There are actually a number of clinical trials currently underway to explore which types of immunotherapies are actually going to be better for certain types of cancers and which specific cancer features, tumor features, are going to respond better to an immunotherapy and different types of immunotherapy. So this is still a very new area of clinical research in oncology, and we're still learning a lot about this. But one of the ways we can actually identify if there could be a potential response is through PDL1 testing. So if the tumor is expressing this PDL1 receptor, then we know that there could be a better response to the immunotherapy, because that's exactly what the immunotherapy is going to be targeting. If the patient's tumor is amenable to tumor-specific testing, tissue testing of PDL1 expression, then the oncologist will arrange to actually have a biopsy of that tumor sample, or a biopsy may have already been done previously to, first of all, identify what type of cancer this is, and that tumor specimen can then be retrieved and further tests can be run on it. And one of those tests could consist of PDL1 testing. Sometimes with specific cancers like colorectal cancers, we're looking at MMR status, which is an acronym for mismatch repair status. And so depending on that status, that if a patient has colorectal cancer, they might be a good candidate for immunotherapy pending their MMR status. So there's tissue-specific testing, and then there's also something called liquid biopsy or liquid PDL1 testing. And liquid is referring to the blood. So if by chance we can't obtain a tumor sample, say the tumor is in a place where we can't easily retrieve a specimen, a tissue specimen, or perhaps it's too small for tissue sampling, then it's a very viable option to actually do PDL1 liquid biopsy testing. So that involves just taking a sample of the blood and sending it to a specific lab, and that's a lab that we work with in the US that can run this PDL1 test. So what they're looking for are circulating tumor cells in the blood. And if those circulating tumor cells are present, then we can run further tests on them, and the lab can do that. And sometimes the oncologist will look at that and validate that, yes, there could be potential for an immunotherapy in this case.